Hello, my name is Tayrn Tindal. I am a registered nurse, and one of my roles at Deerfield is infection prevention. I want to talk with you today about something that I'm sure you've been hearing a lot about in the news, and that is coronavirus disease. It is shortened from coronavirus disease to COVID, co from corona, vid from virus, and d from disease. So COVID-19 is how I will be referring to the disease caused by this virus. Basically what happened is in late December of 2019, a cluster of people in a city called Wuhan in China became infected with a pneumonia that doctors thought was abnormal. And as a response, doctors did what any prudent public health official would do, and they began to try to figure out what the cause of this new syndrome was. And they identified that the cause was a novel or brand new coronavirus. So coronaviruses have been around for an awful long time. In fact, many of us get colds every year that are caused by coronaviruses. But the one that we're experiencing now is a brand new type of coronavirus that has never been identified in humans before. And that's why this situation is so different. So that cluster was identified in Wuhan, China in late December. After that, a number of people in China began to get infected, and that number eventually burgeoned to the point where over 80,000 people became infected with coronavirus disease. Since that time, unfortunately, despite very aggressive containment efforts by the Chinese government, the virus has left China and has been transported primarily by travelers to other countries in the world and now in the United States. You may have heard a lot about the different types of transmission of coronavirus. The most important thing to remember is that we're waiting for community transmission. Community transmission is when someone is infected and they have no idea where they got it. So they have not recently traveled to China where we know that there's an epidemic. They've not recently traveled to other countries where we're certain that there are epidemics. And they haven't had recent contact with a person that we know absolutely has coronavirus disease or symptoms of the disease. At this time in the state of North Carolina, we do have a couple of people who have tested positive for coronavirus, but it is not evidence of community transmission. Each of those people have traveled to an area where they were at special risk for becoming infected with the virus. With that background, I now want to talk with you a little bit about the signs and symptoms of coronavirus because they're really quite straightforward. People with coronavirus, a really large percentage, over 90% with the data that we know, are going to have a fever. After the fever sets in, it may be a short time thereafter or a long time thereafter, the next most common symptom is a dry cough. So when we're talking to you about looking out for symptoms of coronavirus, which we'll be discussing shortly, I want you to be very mindful of fever and cough. Fever, in the case of coronavirus, is going to be defined in a young, healthy adult as any temperature 100 degrees Fahrenheit or greater. Would be a little bit different potentially for children who don't really seem to be getting this virus, or at least don't seem to be getting severe disease, and for the elderly. But for your average Deerfield employee, we're talking about 100 degrees or greater, and the next most common symptom is a dry cough. About 80%, again, from what we know, all of this data is brand new, and we're likely to find that a lot of the numbers and information that we throw out will ultimately change as we learn more. But from what we understand now, about 80% of the people who become infected with coronavirus disease will have a mild syndrome, like the common cold, or even less severe, or may even be asymptomatic. But there's a subset of the population, somewhere between 15 and 20% perhaps, who will progress to have more severe disease. You would notice the progression of that if your fever became much higher, or if your cough transitioned from a dry, relatively mild cough to a deep cough that was productive of sputum. The most common complication of coronavirus disease is pneumonia, and sometimes it can be very severe, and sometimes it can even be fatal. We know that certain people are at higher risk for having severe symptoms with coronavirus. Now, this can happen to anyone, but typically the people who are going to be more severely affected are those who have significant underlying medical conditions, heart disease, lung disease, severe asthma, diabetes, cancer are all good examples, and people who are over the age of 65, particularly people who are over the age of 70. So when it comes to coronavirus, underlying disease and older age seem to be really significant risk factors. In terms of transmission, so let's pretend that I have coronavirus disease. The only way that it can get out of my body and infect someone else is by droplets. So droplets are produced right now while I'm talking, and they're also produced if I cough or sneeze or blow my nose, sort of respiratory droplets of little viral infectious particles, and usually they're encased in some mucus because you sneezed or coughed them out. So in order to infect other people, they would need to be within about 6 feet of me at any given time. So droplets are not airborne. So if you are 20 feet away from me and I cough, that droplet that I produce is not going to be able to get 20 feet across the room and infect you. The furthest that droplets can travel is about 6 feet. All right, so in order to infect someone else with a droplet, I need to be within about 6 feet of them for a sustained period of time, most likely. Of course, if I have COVID-19 and I cough right on you, you're going to have a notable risk. But if you're sitting a couple feet away from me and we're talking, your risk is going to be somewhat low, actually. If we are sitting a couple feet away from each other and talking for an hour, your risk is going to be quite a bit higher than it would be if we just, passed each other in the hallway and said a couple words to each other. So droplets need to get out of the infected person's body and to you in order to infect you. And in order to infect you, the droplet doesn't just need to kind of float by you. It needs some way to get into your body, and the most common way is through mucous membranes. So that would be through your mouth, through your nose, or through your eyes. So you can breathe it in if you're in very close contact. You can also transmit droplets that have fallen onto surfaces, onto your own body through your hands. So if I have COVID-19 and I cough on this table, we don't know yet how long coronavirus is going to live on this table if someone doesn't clean it. But we can use information that we know about other coronaviruses and suspect that it's probably somewhere between a couple of hours and a couple of days. I will tell you that data that we have about coronavirus suggests that it is spread much more readily through the route that I just discussed. So droplet and direct contact with someone who is speaking, coughing, or sneezing. There is evidence to suggest that transmission through fomites, so fomite is an infected surface. There's evidence to suggest that transmission through fomites is relatively low, but still we need to take precautions. So if I were to cough on this desk and you come by and touch the desk, what you do not want to do is allow the virus, which now lives on your hand, the opportunity to get into your body. The way that that would happen is if you take your hand and you touch your mouth, nose, or eyes. That's how the virus gets in. So that's a quick overview of transmission, and now I'm going to tell you how to protect yourself. I think the most obvious segue is to tell you how to protect your hands. So we just talked about your hands being an opportunity to take droplets and put them into your body. In order to prevent coronavirus 19 transmission, and really transmission of any respiratory illness, it's very important that you clean your hands frequently. I want you to wash your hands with soap and water with intention, and I want you to do that anytime your hands are visibly soiled. So if you cough or sneeze into your hand, you need to wash your hand with soap and water. If after you've used the bathroom, before you eat, these are all times when it's important to use a sink, warm water, and soap. You want to wash your hands for at least 20 seconds. The soap needs to actually touch all of the viral particles on your hands, and viruses can live in sneaky places. They can get under your ring, they can get under your nails or up in your nail, in your cuticle area. So you don't just want to sort of haphazardly wash your hands and run them under the water and leave. You really need to clean your hands with intention. So that means making sure that you get this surface really good, making sure that you get the outside surface really well, making sure you get your nails. This is how I do mine, both my thumbs and my fingernails. Get all around the surface of your thumb. A lot of studies have shown that people forget this one. I like to make sure that I get my cuticles pretty well, that I get up under any jewelry that I have, that you then rinse your hands nice and thoroughly. You don't want to use super hot water because that's going to burn you, but nice warm water. All right, and then what you don't want to do is ruin everything that you've done by touching the dirty faucet. So you take a clean paper towel, you shut your faucet off, you toss that, then you take some more clean paper towels and dry your hands and you're free to go. So washing your hands with soap and water is really important. The next thing that you can do is sanitize your hands. And I'm going to show you how to do this too. You want to sanitize your hands anytime really that you have the opportunity. If you pass a hand sanitizing station in the hallway, use it. If you see hand sanitizer at a grocery store or another place where you're visiting, go ahead and use it. If you feel like you haven't washed your hands in a while, now is the time. So with hand sanitizer, you want to use a good full pump. And just like you did with hand washing, you want to clean your hands with some intention. So you want to make sure that you get all the surfaces of your hand nice and wet. I dripped some on the table, that's okay. So I'm really being purposeful. And then I'm not going to touch anything with my wet hands. I'm going to let them dry. And it can take 30 seconds or so to let them dry, so you want to be really cognizant that you do that. It's important that the alcohol, which is within the gel of the hand sanitizer, the alcohol needs time to penetrate the outer shell of the virus. That's how it works to kill it. So you want to leave it alone, let it dry, and then you are good to go. So cleaning and sanitizing your hands frequently is a really, really important way to prevent coronavirus infection. It's also just a good habit to be in. Another thing that I want you to do is try to get in the habit of avoiding touching your face. This is really, really tough. We touch our face for a variety of reasons. We sweep our hair out of the way, we adjust our glasses. I have learned, as I've been paying attention to this, that I tend to sort of lean on my hand. So you want to try really hard to get out of that habit, because then dirty hands, it's another way to prevent their opportunity from infecting you. I want to talk with you about cough etiquette or covering your cough. This, I feel like, should be basic human knowledge at this point, but if you cough or sneeze and you could potentially have coronavirus 19, it's really important that you prevent those droplets from getting very far. So I talked about the fact that the furthest a droplet can travel is 6 feet. Well, we all have the opportunity to contain that distance a bit by not coughing or sneezing openly, right? If you cough and make absolutely no attempt to contain it, then your droplets are going to go everywhere. You should Google it. The spray that is created is actually sort of astounding when someone coughs or sneezes. So one thing that you can do to help is use a tissue to cough or sneeze into and then throw that tissue away. Let me take this opportunity to make a public service announcement, which is that tissues are only supposed to be used once, one time. Don't hoard them, don't put them in your sleeve, put them in your pocket and use them later. Tissues are a one-time use thing. So cough or sneeze into a tissue, throw it away, and then clean your hands. An alternative, if you don't have a tissue available, is to use your elbow. This ends up meaning that your clothes are infected, so you might want to wash them when you get home, but you really don't take the inside of your elbow during the day and touch it to other people. So it's a good, safe place to contain your cough or sneeze if you don't have a tissue available. Now I'm going to talk about something that we don't talk about necessarily very often, when it comes to infection prevention and control. But you're going to be hearing this term, I think, a lot in the coming weeks and months. And the term is social distancing. So coronavirus is different than the common cold or the flu as we know it. First of all, we do believe that this virus is more dangerous and that it is more likely to cause severe disease than cold or flu. We also don't know that much about it, and so we need to be very cautious to prevent its unabashed spread in the community. And one way that we can do that is by keeping distance from others. And the distance, this social distancing phenomenon, makes sense because I told you that coronavirus disease is transported by droplets which can travel about 6 feet. So if we all are able to manage to stay about 6 feet away from each other, then the virus does not have a wonderful opportunity to transmit itself between multiple people. So in the coming, weeks, I think you're going to see recommendations to avoid large crowds of people when possible, particularly groups of people that are packed in tight, in poorly ventilated areas. So we're likely to see recommendations to avoid things like concerts, for instance. We may change the way that you receive some of your education so that you're not packed into a classroom. This is a great example, and I should take the opportunity to say social distancing is exactly why I'm filming this video for you instead of having you all meet in groups in the classroom. It's an opportunity to protect you and to teach you about this important public health measure. So I recommend, as best as you are able, try to keep a little extra distance between yourself and others. Avoid handshaking and try some other things that are going around, like tapping your foot with the other person's foot, or bumping elbows, or like an air high five or something. Whatever you can do to put a little extra contact and droplet distance between yourself and people who might be sick. You want to avoid touching high-touch surfaces. So I mentioned that surfaces can be contaminated. Well, the surfaces that are most likely to be contaminated with a coronavirus droplet are surfaces that people touch a lot. So elevator buttons, handrails, doorknobs. I recommend that you get in the habit of trying to put a barrier between yourself and those things. So I've been doing this for years. I oftentimes have a cardigan on, and I'll sort of loop my hand under the cardigan and use the fabric of my shirt to open a door. If I press an elevator button, I use my elbow whenever possible. If I don't have a cardigan on and I'm going through a door, I might sort of use my elbow to push the handle down. Now, we don't want to panic or become freakish about our attempts to prevent ourselves from infection, but these are little things that you can do to help protect yourself and thereby help protect others. One more thing in regard to surfaces, and this is for just like, basic hygiene in your own home, is those high-touch surfaces. You want to probably get in a routine of cleaning those frequently. Clean the steering wheel in your car, your shifter, doorknobs in your home, and your phone. Your phone is like a scary repository of disease, so get in the habit of cleaning that every once in a while with an alcohol wipe. And for surfaces in your home, know that most commercial, Walmart, normal cleaning products are going to be effective. So Lysol, Clorox products, all of those are going to be effective against this novel coronavirus. And one way that you can check to see if your household cleaner is effective is you can just turn it around on the back and see if it's effective against coronaviruses in general. The current coronavirus, the novel coronavirus that we're talking about, is brand new. But as I mentioned at the beginning of the video, coronaviruses have been around for a long time. So if your cleaner has been shown to be proven against other coronaviruses, we can assume that it's going to be effective against this coronavirus too. Now I'm going to talk to you about the most important infection control measure of all. This is really why we're filming this video. So if you've tuned me out, please tune back in now. If you are sick, you need to stay home. All right? If you are sick, please do not come to work. Do not come to work because you feel that you need to prove to us that you are sick. If you are sick, we trust you, and we want for you to stay at home. So all employees across Deerfield, regardless of your department and your contact with residents, are encouraged, actually required, effective immediately, to contact your supervisor as soon as you have any fever. Now, this would be a fever that you're able to confirm with a thermometer, or just feeling feverish or having chills. You need to report that to your supervisor immediately. If you develop a new cough, you need to report that to your supervisor immediately. What I mean by new is that it's non-chronic. Some people have coughs and they've had that cough for years and years. If you develop a cough that is not normal for you, you need to let your supervisor know. So fever or cough are extremely important symptoms. They are very specific to coronavirus disease, and we need to know immediately if you have them. Please do not wait until right before your shift, and please do not come to work to prove to us that you do in fact have those symptoms. Please let us know, and we will work with you accordingly. We will not be holding people out of work blindly. What will happen is that you will be in contact with probably myself or another infection control trained nurse. We will triage your symptoms, learn more about your circumstances and your risk, and make a decision about when it's appropriate for you to come back to work. But please, please stay home if you are sick. In addition to you being symptomatic, we need for you to report the following additional risk factors to your supervisor. If you have traveled within the last 14 days to a place that turns out to have community transmission of coronavirus, you need to tell your supervisor. Right now, those places include China, Italy, absolutely, South Korea, some countries in the Middle East, and at this time, places in the United States, including Washington State, a number of counties in California, and New York City. That is going to change rapidly as more places in the United States and across the world begin to experience community spread of coronavirus. What I would suggest is that you let your supervisor know if you are traveling, and we will then help you to understand what your risk is. So please report travel to a risky area to your supervisor as soon as possible. I also need you to report as soon as possible if you have close contact with anyone who has coronavirus that has been diagnosed, or someone who has the symptoms that we've told you to watch out for. So if your husband or girlfriend or child or mother, someone that you spend a lot of time with, develops a fever or cough, if you spend a decent amount of time with them, being more than 10 minutes within 6 feet of them at any time, you need to let us know about that contact. It is very important that we all take coronavirus disease seriously, work together to prevent the spread of this contagion within our community. We have a unique responsibility because of the environment in which we work. We are serving people, the elderly, who fall in a particular risk category for having severe coronavirus 19. Most of us as employees are at relatively low risk, and we may experience very mild coronavirus symptoms if we become infected with the disease. But we have a responsibility to be very mindful so that we prevent transmission to our residents, who are much more likely to have serious consequences if they were to become infected. So I tell you that while also explaining that there is, as of yet, no reason to panic. What we're asking for you to do is to become informed, to follow any videos that you see on this topic or any memos about coronavirus 19, to follow them very closely, to attend very carefully to the suggestions that I made for how to protect yourself, and to be very, very aware of your personal risk and report that to your supervisor just as soon as you are aware of it. Thank you very much, and there will be quite a bit more education to come. Take care.